Welcome back, guys. Thank you so much for joining me today. Today we're talking about anxiety, chest pain. I'm gonna explain it, try to tell you why this is happening, give you some reassurance if I can. Go ahead and smash the like button down below if you're ready to kick anxiety in the butt. Leave me a comment, let me know if you dealt with this particular symptom of anxiety. It's very scary, it's frightening, it's concerning, alarming. These are all great ways of explaining chest pain, because when we think of chest pain, we start thinking about the heart. I had heart anxiety. Another technical term for that would be cardiophobia. Many of you out there who are dealing with health anxiety or hypochondria, many of you started off fearing your heart, and that was kind of the case with me. My first 2 to 2.5 years of my health anxiety days, I was consumed with this fear of having a problem with my heart. And a lot of this came down to chest pains, all right, and the symptoms of my panic attacks. Now, there are a few things that are causing this. Make sure that you are tested by a doctor, of course, in the beginning. I don't want to give out any dangerous information. It's your responsibility to go get checked out by the doctor and make sure that you get the proper testing, get the A-OK from them. They are professionals, I'm not. I can't diagnose you with that. But once you were told that you have anxiety and that wasn't a heart-related issue, you need to move forward, okay? You need to take that reassurance as a breath of fresh air, but still start working on your anxiety. So this video is for you if you've gotten that reassurance already. If you haven't, stop watching, go get your reassurance right now. So what is going on? There's a few things. Muscle tension can be present pretty much all throughout the day if you just have high levels of anxiety. That can also cause the muscles in and around your chest to tighten up. Another extreme case of this is whenever you have an adrenaline push associated with our fight or flight or freeze response. And what happens here is we're trying to either run away or fight away a danger, okay? If it becomes too overwhelming, we enter our freeze response, basically and submit, all right? We freeze up. But most cases, we are trying to get away or we are trying to fight off dangers like a tiger, or we're in battle with something or someone like a burglar, all right? There's a dangerous situation and we feel like we either can get away or that we can fight it off to survive. It's very important, it's normal. So understand that this is a normal process. If this is working for you, that means that you are normal, okay? And your body's doing what it's supposed to do. The problem is that we are thinking of meeting strangers or being out in public or leaving our house or darkness as huge dangers, okay? But they're not. They're everyday things that we have to deal with, but our body is trying to prepare us for battle when we enter this stress response. So once that happens, our breathing goes up, all right? One of the first things. Heart rate and palpitations start. That was the very first symptom that I got, was a palpitation. Our muscles tighten up, all right? Our blood pressure goes up. You look up all of those symptoms online on Google, which I don't encourage you to do if you've already been down that route. That's one of the very first things I did. You look all that up, at the top it's gonna tell you heart attack or some really bad heart problem. So whenever this happened in my first panic attack of 6 hours, I was convinced. I was like, I'm having a freaking heart attack. In fact, the muscle tension got so great for those 6 hours that my chest hurt so bad for 2 to 3 weeks afterwards. Now guys, there's all types of chest pain. There's dull, radiating, crushing, sharp, shooting. I had it in the left, I had it in the right, the bottom, the top, the center, you name it. I would have shooting pains down my arms, numbness and tingling, which has to do with your fight or flight response as well, where the blood flow centralizes to your core. So whenever the blood leaves the extremities, some of you are dealing with that numbness and tingling. You put that in with the other symptoms I mentioned, and it basically is telling you that you're having a heart attack. The problem is that symptoms of our fight or flight freeze response and or panic attacks, for instance, are very similar to heart attack symptoms. So once you understand how anxiety works, you can really start to trust your body and understand what's going on. Your body is just trying to protect you. It's actually a beautiful thing. It's a beautiful thing. But just realize that, take symptoms for what they are as anxiety symptoms, as long as you've been cleared by the doctor. Now, something else that could be happening, that's related to anxiety. I know I had a pre-existing issue with GERD, heartburn, acid reflux. It got much, much worse whenever I had anxiety. So I had this lava hot acid reflux creeping up into my throat, okay? So it's coming up through the chest area. So I would have these burning sensations here, esophageal spasms as well. That can be increased by anxiety. I had a few of those. Those can cause chest pain. But yeah, if you deal with those issues, make sure that you start taking some apple cider. You can either get little capsules, those are easy but more expensive. You can get a big bottle of apple cider vinegar, take 2 teaspoons of that in the morning, mix it with a regular full glass of water, put a little lemon and use a straw because it can be kind of hard on your teeth. 2 teaspoons of that, all right? It even helps with weight loss, digestive issues, but it's gonna help you with your heartburn. I have not had any heartburn as long as I have taken that in the morning. So think about it, much cheaper than heartburn, acid reflux, GERD medications. And some of you are prescriptions for that. The next thing is trapped gas or air. Now this can be caused from rapid shallow breathing, taking in a lot of air and it just doesn't get out fast enough, or it can actually just be caused from digestive issues. See, our stomach produces a lot more acid that leads to acid reflux, but it produces a lot more gas as well. So that gets caught up in there. I would feel the pressure of this in my upper abdomen, and it's so close to the chest that, these pains can kind of overlap. And that's how I'd feel. When I had trapped air and trapped gas that wouldn't be able to come out, I felt like it just put a lot of pressure on my chest. I would feel pain that way. So those are some ways that you might be feeling the chest pain. I'll go over them again briefly. Muscle tension from our fight or flight or freeze response, or just muscle tension in general from being anxious, esophageal spasms, acid reflux, heartburn, GERD, and then trapped air and gas are the most common reasons anxiety is causing your chest pain. So I hope I gave you some reassurance. Guys, if you haven't gotten my free ebook, please, it's down below, Anxiety Symptoms Explained. It is free, so check that out. I explain a lot of other symptoms in that book. So guys, I have other resources in that description. Remember to leave me a comment. Let me know if this is something that you deal with, and hit that like button if I gave you any value. Guys, I love you. Subscribe if you haven't. And until next time, I will talk to you guys later. Bye.